Moving your practice online has so many different moving components that you need to think about. My name is Dr. Meghan Walker. I'm a naturopathic doctor and the chief cheerleader over at Clinician Business Labs. 5 years ago, we moved a portion of our practice online. And so understanding the technology required to make that transition easy, simple, and compliant with regulations is something that we know well. When you are moving your practice into the online space, there's a few considerations that you need to have a look at. First and foremost is the actual tool or telemedicine platform that you are going to use. When you are assessing the tools available to you, there's 3 considerations that I want you to keep in mind. The first is privacy. Privacy is the legal requirement that you're going to have in place when you are using technology in the online space for patient care. If you are in the United States, the privacy standard that you're looking for is something called HIPAA Compliance. HIPAA Compliance means that technology has integrated all the requirements of government to satisfy patient confidentiality laws. In Canada, what you are looking for in terms of a standard is IPPA Compliance. It's basically the same as HIPAA. It just has a few additional requirements related to where patient data is stored. So privacy is the first requirement that you need to look at. And if the tool you're looking at passes that requirement, the next piece I would encourage you to consider is integration. By integration, I mean, how well does the tool that you are choosing to use for telemedicine integrate into the existing technologies that you have in your practice? The first place I would encourage you to look is your existing electronic health record system. So many systems are offering telemedicine options, and some, although in their infancy, will probably be the easiest transition for you. So look first to technologies that you are already using. Secondly, select a telemedicine tool that is going to work well adjacent to a technology that you already have. In this case, I'm thinking about electronic health records or other tools that you are using to interface with your patients. So privacy, integration, and finally, the patient user experience. It's awesome if your platform covers the privacy needs and your existing electronic health record has a portal to engage in telemedicine. But if it is clunky and difficult for your patients to be able to access that portal, it may not be the choice for you. Remember, your job as a practitioner is to make it easy for patients to access your care. One of the things I would encourage you to do is set up a virtual appointment with a family member, a spouse, a parent, a kid, and make sure that it is simple and easy for them to get onto your platform. And so both of you understand what the experience is going to look like from the side of your patient. Privacy, integration, and the experience for your patient. These are the 3 biggest things you need to consider as you're making this really exciting transition online.